Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad HADI SUGIMAN and I am from 2433C. And today I will present about how exercise can manage the symptom of chronic disease and improve our health too. Before I start my presentation or my sharing, I want to give you guys a question. If you guys have a chronic disease, will you be exercising or you just depending on your medicine? Think about it and answer it yourself. I want to share with you guys, one of the unhealthy lifestyle is people not regularly exercising and always thought that just eating medicine can cure it. But I want to tell you guys, it is not enough guys. Many people do not know when we exercising, we also can manage the symptoms of our chronic disease and also can improve our health. I want to tell you guys that all of this information I get with a research that I have been doing it and not just blindly share it with you guys. I have done my research and I have read a lot of articles. And one of the article from Mayo Clinic website says that if we have a chronic disease, we can do an exercise, but we must ask our doctor first whenever we want to do it regarding to our health. Don't worry guys, there are many various types of exercise that people with chronic disease can do. Even though the people with chronic disease are limited to some of the exercise out there. But this means that if the person have a chronic disease, it does not mean that he or she can't have an active and healthy lifestyle. Next, I want to share with you guys how can exercise improve a chronic condition. If you have a chronic condition, regular exercise can help you manage symptoms and improve your health, just like I tell you before. And this time I will tell you more details. Aerobic exercise can help improve your heart health and endurance and also aid in weight loss. High intensity interval training is generally safe and effective for most people and can take less time. In high intensity interval training, you alternate exercising at high level of intensity and low level of intensity in a short periods of time. Even activities such as walking at higher intensities count. Strength training can improve muscle strength and endurance. It will make your daily activity more easier, slow disease-related declines in muscle strength, and provide stability to joints. Flexibility exercise may help you to have optimal range of your motion, optimal range of motion about your joints, so they can function at their best. And stability exercise may help reduce the risk of you falling down. And now I will give you the specific example. Heart disease. Regular exercise can help improve your heart health. Recent studies have shown that interval training is often tolerated well in people with heart disease, and it can produce significant benefits. For people with blood pressure, exercise can lower your risk of dying of heart disease and lower the risk of heart disease progression. For diabetes patient, regular exercise can help insulin more effectively lower your blood sugar level. Physical activity can also help you control your weight and boost your energy. If you have type 2 diabetes, exercise can lower your risk of dying of heart disease. And for the asthma, often exercise can help control the frequency and severity of asthma attacks. And for the cancer, exercise can improve the quality of life for people who have had cancer, and it can also improve their fitness. Exercise can also lower the risk of dying from breast, colorectal, and prostate cancer. And next one, why exercise is a wonder drug. Exercise is seen as pleiotropic, simply meaning that it has many effects, says Sean Flanagan, PhD holder and assistant professor in the Department of Sports Medicine and Nutrition at the University of Pittsburgh. Exercise can enhance sleep, protect and improve brain function, develop or maintain bone, muscle, heart and other connective tissues, and promote a healthy immune system, he says. Won't heal faster. Medication doses can sometimes be reduced or maintained, and disease severity can be improved considerably depending on the condition, Flanagan adds. The practical benefits are impressive. When it comes to the brain, Flanagan says exercise promotes the release of a number of factors that protects our neurons, improve recovery from injury, and likely enhance the integrity of the blood-brain barrier. What is the blood-brain barrier? Blood-brain barrier is a group of blood vessels that control what gets transported from the blood into the brain, making sure toxins, pathogens, and inflammation stay out, and helpful cells and molecules get inside our brain, our blood. All those things are important when it comes to staving off chronic disease. Flanagan explains. Neuron damage and inflammation in the brain, for example, are known to happen in people who have multiple sclerosis, Alzheimer's disease, and Parkinson's disease. For example, there is not a condition out there that fitness can't help, says Scott Parker, a personal trainer in private practice in Los Angeles and a spokesperson for the American Heart Association. While there's a lot of conversation about how to exercise to get a certain body type or look, people can overlook the fact that a huge function of exercise is to maintain and improve our overall health. Here's a closer look at how exercise can improve management and symptom relief for several chronic health conditions. And remember, if you have a chronic health condition or other chronic symptoms, check with your doctor before starting a new exercise routine to make sure it's safe for you to do and won't cause further damage to you. Now, I am going to show you the percentage of adults aged 18 until 64 with disabilities who have one or more chronic disease by aerobic physical activity level. We can see on the left chart, when they are inactive, 46% have one or more chronic disease, compared to if they are in active lifestyle, the percentage are much lower than the left chart. The percentage at the right chart is 31% only. And next one, what exercises are safe for chronic disease patients? Doctor might recommend specific exercise to reduce pain or build strength depending on your condition. You might also need to avoid certain exercise altogether or during flare-ups. In some cases, you might need to consult a physical or occupational therapist before starting to exercise. If you have low back pain, for example, you might choose low-impact aerobic activities such as walking and swimming. These type of activities are suitable for you guys. If you have arthritis, the exercise that are best for you will depend on the type of arthritis and which joints are involved. Work with your doctor or your physical therapist to create an exercise plan or routine that will give you the most benefit with the least aggravation on your joints. And how often, how much, and at what intensity that a patient with chronic disease safely exercise. Before starting an exercise routine, it's important to talk to your doctor about how long your exercise session can be and what level of intensity is the session. In general, try to accumulate about 30 minutes of physical activities a day, at least 5 days a week. For example, try walking fast for about 30 minutes most days of the week. You can even break physical activity up into short chunks of time spread out through the day. Anything is better than none at all. If you're not able to do this much activity, do as much as you can. Even an hour a week of physical activity can have health benefits for you guys. Start with moving more and sitting less and work your up to moving more each day. Just keep moving, guys. If you have not been active for a while, you must start slowly and build up gradually. Ask your doctor what kind of exercise goals you can safely set for yourself as you progress. And lastly, the conclusion. Chronic disease are the leading cause of death worldwide as disease incidence rate continue to rise. Most chronic disease that occurs in middle to low income society as well as in developed countries. As the prevalence of this disease rise in adults, chronic disease such as type 2 diabetes and obesity rise in youth and adolescents, including physical activity and exercise into daily lifestyle activities provide multiple health benefits, promote societal growth and provide long-term chronic disease prevention and treatment while improving overall global health. Thus, physical activity and exercise provide a non-invasive means for added chronic disease prevention and treatment. Additional physiologic, biochemical and molecular information regarding physical activity and exercise health benefits are useful. Important areas for future research include how to get more people to overcome the physical activity and exercise barriers for themselves, better understand the interaction of medication with physical activities, and regularly exercise.